Hello, I am Dr. Mini Salunkhe, Consultant and Director of Obstetrics and Gynecology at Momstory, Sahyadri Hospitals, Hadapsar. Thyroid disorders are very common during pregnancy. The reason is that the pregnancy hormone and the thyroid hormone mimic each other. That is why when the pregnancy hormone rises, the thyroid hormone also rises. So the TSH levels during the pregnancy are considered to be normal if the TSH is less than equal to 2.5 to 3. Any TSH levels which are more than that warrants treatment during the pregnancy. So what happens afterwards? During the pregnancy, we give the patient the thyroid medication. After the delivery, again the thyroid hormones are investigated and we give the patient the thyroid hormone treatment 6 weeks postpartum. Usually after 6 weeks of delivery, the thyroid hormone comes back to normal. When it comes back to normal, then the patient asks the doctor, will I have the thyroid lifelong? It is not necessary that she will have the thyroid disorder lifelong, because this depends also on the genetic history and the family history, whether her mother or any other relatives are suffering from thyroid. But usually hypothyroidism during the pregnancy, it gets recovered within 6 weeks. Usually how do you investigate afterwards is we tell the patient to do the thyroid hormones every 3 months for a year. If within that year the thyroid hormones are normal, she does not require any treatment. As against that, those women who already have had a thyroid before their pregnancy, would definitely the thyroid hormones medication would continue during the pregnancy, and after the delivery also maybe the thyroid hormone levels would come back to normal within 6 weeks, or they would come back as the pre-pregnancy levels, and the thyroid hormone therapy would continue throughout the life. The delivery would definitely reduce the thyroid hormone levels. There is something called postpartum thyroiditis, in which there is a temporary inflammation of the thyroid gland during or after the delivery. So what happens here is that the patient neither has had thyroid disorders before the pregnancy or during the pregnancy. It is suddenly that the thyroid hormone becomes inflamed and she develops the thyroiditis or the thyroid inflammation later, because of which we have to involve the physician and the endocrinologist and give her treatment for this thyroid storm. For more information, you can visit Momstory, Sahyadri Hospitals, Hadapsar.